I am a neurologist, and I work most particularly in movement disorders. Movement disorders are conditions not of weakness per se, but problems of coordination. So instead of weakness, we get stiffness. Instead of paralysis, we get tremor. The largest and most common disease of this category is tremor. The most common patient we see is a Parkinson's disease patient. We do try to explain the process, how it will unfold over the next few years, perhaps looking back, explaining things that have happened over the previous years of the patient's life, why that all fits together. The actual treatment of the condition would include medications, of course, but different kinds of medications. So we try to minimize side effects and maximize a positive effect by, picking and choosing which medications are appropriate. We also emphasize a lot physical therapy, as well as occupational therapy, speech therapy, swallowing therapy. It's really rewarding to have people come in, say, I'm having trouble, I have tremor, I have stiffness, I can't walk, whatever it is, and then at subsequent visits saying, I'm doing much better, thank you.